Thank you. Again, welcome. And we will also be sharing today's slides in the chat box. But before we get started, I'm going to go over a few housekeeping details. If you haven't done so already, please connect your video feature by selecting the camera icon in the lower left corner of your screen. To avoid background noise and feedback, please remain muted when you are not speaking. To unmute your line, simply select the microphone icon in the lower left corner of your screen as well. The Zoom platform also features a chat box located in the bottom ribbon. If you have any technical difficulties, questions, or comments today, please feel free to reach out to me in the chat box. And now I'll hand it over to Janine, excuse me.
Okay, sorry about that. I was muted. Thanks, Robbie, and good afternoon. I just want to thank everyone for joining us today for the FY22 NCC kickoff webinar. This webinar is hosted by the SHIP TA provider, the National Rural Health Resource Center, or the Center. And I'm joined today by the SHIP team, both from FORP and from the Center. I am Janine Myers from FORP. I'm currently the acting SHIP coordinator and also the SHIP PO for Regions A and C. And so I guess I'd like to take a minute to have the other members of the SHIP team briefly introduce themselves, and we can start with Sarah.
Hi everyone, I'm Sarah Kohler. I'm a HRSA project officer on the SHIP program. And I'll pass it over to Matt.
Hey, my name's Matt. I am a program specialist with the National Rural Health Resource Center. I work with both TASK and SHIP. And yeah, been here for a while, excited to be here. And I'm actually going to launch the poll while we do introductions. If you wouldn't mind finishing that up, that'd be awesome. Just starts with a simple question of, hey, how you doing? Just to kind of get you warmed up, and then a few other questions. Of course, we have a post poll as well, so stick around for that. But take a second to answer those 3 questions for us, and I will pass it over to Sally.
Thanks, Matt, and welcome State SHIP coordinators and staff. I'm Sally Buck, the CEO at the National Rural Health Resource Center and Program Director on the Small Rural Hospital Improvement Program, or SHIP, Technical Assistance Team. And I will pass it over to our newest TA member, Caroline Bell. Caroline?
Hi, everyone. My name is Caroline Bell. I'm in my 2nd week with the center, and I, like Matt, am part of both the TASK and SHIP programs.
Okay, is that everybody?
I think it is.
Okay, all right. So I would just like, on behalf of the team, to give a shout out to our new SHIP coordinators. I know we've seen a lot of transition in the States. And so for our new SHIP coordinators, welcome to your first NCC kickoff call. I hope it won't be your last one. And certainly welcome aboard the SHIP program. We're happy to have you. Looking forward to getting to know you better and being able to help you as you move the SHIP program forward in your state. So with that, we can move on to the next slide, Robbie. Thank you. This is the agenda. These are the sort of topics that we're going to cover today in the webinar. So just the general purpose of SHIP, some important dates for you to remember. We're going to go over the instructions and the attachments of the NCC. We're going to talk about the SHIP Allowable investment menu, as well as the SHIP Allowable investment search tool, which is a relatively new tool that we have out there. I hope you all have had an opportunity to use it. And then we're going to spend some time talking about unallowable investments, and then resources and contacts, and then we will open it up for Q&A. Next slide, please. And I'll turn this over to Sarah.
Hi all, so as I said, I'm Sarah Kohler, SHIP Project Officer for the time being. Just going to do a little overview, background on SHIP. The main purpose of SHIP is to support small rural hospitals by meeting value-based payment and care goals through purchases in hardware, software, and training. These purchases are to fall under the main investment categories, which are value-based purchasing, accountable care organizations and shared savings, and payment bundling and prospective payment systems. Through these investment purchases, expected program outcomes include cost savings, improved efficiencies, and improved quality of care. Next slide, please. All right, now diving into some upcoming deliverables and deadlines. Keep in mind that these are all dates in regard to the program year FY22. So the first one is the non-competing continuation, or the NCC, which is due in EHB on February 11th, 2022. And the template should be available to you now in EHB. If you would like to submit your NCC work plan for review, please do so by January 28th. And you can do that by emailing the task team, which their email address is on this slide here, ship-ta@ruralcenter.org. On August 29th, 2023, the FY22 annual report will be due in EHB. And then the FFR, the federal financial report, will be due in the payment management system on October 30th of 2023. And then any carryover requests after that will be due 30 days after submission of the FFR on November 30th. All right, next slide. And I'll pass it back to Janine.
Okay, so we're going to go over the instructions and the attachments. This slide is going to look very familiar to you, pretty much the same as last year. I think only a couple of changes. And so, okay, I'm trying to move the, hold on a second. Okay. So we have the SF PPR form, and that's just a HRSA standard form, as well as the standard form PPR2, which is a cover page continuation. Both of those will need to be submitted. Both are forms, obviously. And we ask that you refer to section 3.2 of the NCC Progress Report User Guide for grantees for directions and how to complete those forms. The next section is the performance narrative. Note that there's a 12-page limit for the narrative. And in the narrative, you're going to cover basically your overall program, a summary, progress, and this is a requirement for all grantees. You're going to speak to plans for the coming budget period. This is also required for all grantees. And then you're going to talk a bit about your monitoring, how you're monitoring your grantees. That also is required. And then a bit on your program activities. And so this is going to be attached as one document, a Word or a PDF. And you can refer to the performance narrative section of the NCC for additional details. I think it begins on page 2 of your NCC. And it includes, I'm just going to give you a breakdown of what it is. There are about 8 headings there. And it's progress on activities, accomplishments, staffing and personnel, any significant challenges or unresolved issues. And by that, we're talking about issues that sort of prevented you from completing your approved work plan activities. Again, you're going to speak to monitoring and also deviation due to forfeiture of award. And by that, we are referring to any hospitals that you included in your NCC for funding, but later for whatever reason, they decided to forfeit the funding. And so we ask that you speak to that a bit. And then any significant changes or barriers. And by that, we're referring to any significant changes that required you to do a prior approval. So like a scope of work, a change in key personnel. We just ask that you briefly speak to that. And then, of course, your plan for the upcoming FY22 budget period. And so those are those are the sort of topics of information that you're going to include in the program narrative. In terms of attachments, there are 6. 7 is other relevant documents, but for attachment 1, you're going to attach the FY21 current work plan. Attachment 2 is the SHIP activities progress file. 3 is your future work plan. Attachment 4 is the funding spreadsheet. Attachment 5 is the special innovation project progress, and that's only if it's applicable to you. I think we only have like 3 grantees that are doing those. And then attachment 6, your budget and justification narrative. And then 7, any other relevant documents that you want to include. And I want to note here that in previous years, the budget and justification piece was its own specific submission category. We were asked to change that this year and actually include it as attachment 6. So your budget information is no longer a standalone specific requirement. It's actually attachment 6 now. Next slide, please. And I will turn it over to Sally.
Thanks, Janine. So all of the required attachments and templates that Janine just covered, we have available as downloads or links in the SHIP TA website under grant guidance. And so you'll see on the left side there, and that starts off with the instructions that Janine just ran through right from EHB. So if you need reference to that, and we say it's important to follow the instructions in this document. So when you upload to EHB, you're labeling all the documents correctly, and that the performance narrative, order, and headings such as progress on activities, accomplishments, your staffing plan, significant challenges monitoring, as she said, those are all in order as well. And so we start with the instructions, and then there's attachments 1, 2, 3, and 4 that are loaded up. And attachment 1 and 2 are work plan. So the current year, fiscal year 21 and then 22. So those are Word documents to modify and either upload as Word or PDF. And then attachments 2 and 4 are the spreadsheets where you're copying, pasting the list of hospitals that you're currently funding through SHIP, update on their progress, just a few columns. And again, like of last year, if there's significant progress and outcomes, to note that. Attachment 4, the plans for the coming year. So there aren't significant changes from the prior year. And then just another view of those pages are on the tables below. Again, that we've just tried to organize all of those to make them easier to find.
Really, as we go to the next slide, I'm going to ask Janine. We had several questions in the chat box about SF424A. Can we take a second to answer those, Janine?
Sure. Yes. So I have been told that the SF424A is not required. So that is, the official word that I've been given. Now, I don't actually see what you guys see when you go into EHB to do your application, but I'm told that you do not have to submit the SF424A. So only the line item budget and then the budget justification narrative And to my knowledge, no, we do not have a sample budget, right? But if you go to the user guide, you should be able to find information there on your budget, how to do your budget.
Okay, thank you, Janine. I think this is your slide anyway, but wanted to touch base with that. I hope that got everyone's questions answered about the SF424A.
Yeah, sure. So in terms of the allowable investment menu, we are going to continue the suspension of HCAHPS and ICD-10 priorities. So HCAHPS and ICD-10 will remain on the menu. So hospitals are certainly free to invest in those areas, but they are not required. We are recommending that hospitals utilize funding around quality improvement or healthcare finance requirements, such as, but not limited to, development or implement training, hardware, software that supports the application and expansion of telehealth or telemedicine, and then also to comply with CMS price transparency rules. So these are simply recommendations. They are not priorities. Hospitals do not have to utilize funds in supportive activities in these categories. Yeah, so not a priority. Hospitals are not going to be penalized for that. So yeah, so HCAHPS, ICD-10 still suspended in FY22.
Okay, still wondering, yeah, Janine, so someone's still wondering where we can find the SFPPR and PPR2 forms.
Okay, so those forms will be in EHB. You'll need to go to the user guide for grantees, and you should have a clear instruction in the user guide for grantees as to how you do those forms.
Thank you, Janine. And I will post the link to that just in case somebody missed that user guide.
Yeah, and I think it's in the NCC, the link, if I'm not mistaken. Yes. Okay, next slide, please.
Sally, that's you.
Get myself unmuted there. I was trying to pull up the page number of it's page 12 in the user guide for the forms that we're looking for that are built in. So the SHIP investment menu for fiscal year 2022, this is a screenshot from the website with the link. We have the allowable investments for fiscal year 22 loaded right into the website with live links to example information and resources. Also, you can see right under the title clarification of allowable and unallowable investment, there is a PDF document, and that is handy to maybe send out with your hospital applications. It explains the suspension of the priorities, and then it does list the activities for hospitals. So then I will go to Matt on the allowable investment menu, some highlights.
Yeah, so next slide, Robbie. And so we try very hard to keep all the information that we give you up to date. We know that you guys are working hard. It's a crazy time. SHIP is taking up a lot of time. So the whole team is working very hard on making sure that you have relevant information. And so these are some of the recently updated activities, and we'll show a few screenshots here in just a second. But under value-based purchasing, we have 2 new resources and a couple new examples. We definitely want you guys to go there. This is a great place. This part of the website is a great place to, number one, get ideas, to check to see what you're doing is appropriate. But also, if you're involved in a cohort or a group I call it a group project because I'm still used to being in school, a group project. These are great places to get ideas on how you might be able to do that. So under accountable care organization and shared savings, we have new language on pharmacy services training and a couple new resources there about the ambulance agency transformation toolkit. And then we clarified the activity under payment bundling on pricing transparency training. Again, be careful on the language changes. You all know that sometimes little changes can make a big difference. So we want to try to make sure that we're keeping up on it. Bookmark this page. I would, Caroline, just put the link in the chat box again. And so you can just refer back to it. Next slide, Robbie. And so here's a look at the allowable investment menu on the value-based purchasing. These were just taken yesterday and put on there. And you can see that we've marked new resources with an asterisk. So they're easy to find. You can see where I've been clicking on stuff, checking to make sure things are okay. Next slide. Here's the ACO. Again, if you look over on the left side, I also put an asterisk over there to let you know that like some of the language has changed on that population health stuff. Yes, Catherine Miller, to verify telehealth hardware and software are allowed so long as it's for SHIP. Yes, as it fits the parameters for SHIP and it is not paying for staff salaries. Of course, we always encourage you if you have any questions to let us know. And you asked to clarify for pharmacy. Again, it can be for training of the pharmacy. It can be for material to operate a pharmaceutical operation, but it cannot be used for staff salaries. That's really important. And it cannot be used for direct patient care, if that makes sense, which usually doesn't, but that's kind of the key thing that equipment, some of it can be used for SHIP so long as it's not a permanent building expansion or building place. So like a vent hood in a pharmacy wouldn't be a qualified expense. But like a printer that prints labels away from the pharmacy, like a telehealth printer, that would be, but a permanent printer in the pharmacy itself would not be. So you kind of see the difference there. You can, yes, Stephanie, you can pay for the subscription for telepharmacy service so long as it's meeting the SHIP guidelines on what it's for, value-based care or value-based purchasing. Catherine Miller, does it have to be below 5,000? I will pass that question to Janine. I'm not sure what.
Yeah, so for HRSA grant purposes, yes, equipment is classified as $5,000 or more and with a useful life of 1 year.
Great. So again, if it's a permanent installation, it's probably going to cost you more than $5,000. But we have had some questions about like hoods and like safes. Those type of things are not allowable because they're permanent part of the day-to-day operations and not like an improvement. Johnny, that's a good question. Will negative pressure ambulance for transporting patients, would that meet purpose of grant under mitigation? That's an important distinction to be made, that this is not COVID testing and mitigation grant. This is your normal SHIP grant. And so the negative pressure ambulance for transporting patients probably would not be allowable under your normal SHIP grant. You can check out the COVID page for that if that is related to COVID. I hope that answers your question. Next slide there, Robbie. Here's some more ACO again, some just examples there. I'm just going to go to the next slide. This would be your payment bundling and different things. We had a question recently about ICD-10. A big question that we kind of come up with too is subscription services. That's been something that we're working on verifying. It's always best to ask. Some subscription services, if they are strictly for like an ICD-10 software, are allowable. If the subscription service includes like hospital-wide training where you can learn CPR and you can learn all, but it happens to include ICD-10, then that's not going to be allowable, right? Always best to check if you have a question, but a lot of subscription and certification things are not allowable. Pharmacy herds are not allowed. Yes, that was correct, Kathleen. Next slide. And yeah. So we have added a ton of new examples. And now that I've been here a while, I'm pretty frequent in how to update this page and this website. So hopefully we will keep it updated even more frequently and still do 2 major updates every year, but I'll try to add things as they become a little more frequently asked. So again, the allowable investment search tool can be used by you if a hospital asks, or you can just tell your hospitals, go to this site and check it first before you come to me. It can still be confusing, so you're more than welcome and always welcome to come back and ask us. So you will see a red hand that says no, or a check mark if it's yes, and you'll also see the option, which I didn't put on there. It's a yellow one. It's just prior PO approval. And so when you get on that page on the right side of the screen now, you'll see a whole list of keywords. These are all the things that we put in keywords about SHIP. Everything from swing beds to cybersecurity to ICD-10 to marketing. Those are all covered. Now, I want to be very clear that these are regular SHIP items. If you have a COVID question, there's a different category for that in the search tool, but that's not what we're talking about today. We've also made clear that when our meta search behind the scenes, that if you put printed material and add an S, that will show up. If we just put print, or we try to make it real intuitive of what you on the ground might be experiencing or typing in. So you can type in coronavirus and that will pop up, or COVID, or you can type in herds, hooding, any type of thing like that. And so let's see here. The ICD-10 software, Misty, was about whether or not you can SHIP expenses or SHIP money can be used to purchase an ICD subscription as long as it fits within the category of PB or PBS investment activities, which is A, and it's training that updates and computerized hospital policies and procedures to comply with ICD-10, or hardware software investments that improve quality, efficiencies, and coding. A lot of new programs, kind of like Adobe or Microsoft Word, you can't buy like a set system now. You have to download a program and pay for it monthly. And that includes some ICD-10 software. So if that's the purpose of your purchase and your subscription, then that would be allowable. Next slide. And I think that is going to sell.
Yep.
I'm sorry, Sally. I just went into all these questions about allowable and unallowable as they popped into the chat box, knowing that this slide was coming up. So y'all keep on coming.
No worries. It covers some of the common unallowable activities that we see through that we've put in the search tool, or that have come up through technical assistance questions that are posed to us and Janine and Sarah at F4HP. So some of those are direct patient services and treatment, pharmacist services in terms of like the actual medication, or a staff pharmacist at a hospital would not be allowed. Certain fees like bank services, architecture, penalties for non-compliance of pricing transparency would not be allowed. If there are other types of fees, then we recommend you do send those in to SHIP TA, and we can check and see if we've had a determination from F4HP on that in the past. If not, then we would reach out to them. Pricing transparency software after the first year of implementation. So if they implemented software last year to meet the January 1 deadline, then going forward, only training would be appropriate. Hospital accreditation and provider credentialing are not allowed under SHIP, or patient supplies, room equipment, such as sinks, phones, TV, iPads for patient use. Assessments for community health, financial operations, outpatient surveys. I will say cybersecurity assessments are allowed in terms of risk assessments under the HIT activity. And then ongoing unallowable expenses and activities, hospital staff salary and staff travel.
Sorry, Misty had her hand up. Misty, did you have a question?
Yeah, mine's about the price transparency. So if hospitals didn't just pay one lump sum to purchase the software, they're doing a subscription because it's continually being updated, that would not be allowable into the second year? Because the other subscription services are.
Right. The other subscription services, like for HCAPS, are related to ongoing quality improvement, where hospital pricing transparency has become an operational regulation. So the determination was made that that would not be allowable year after year.
Okay. Even though it improves the care, it improves the care to patients about knowing their pricing beforehand. And if they're tracking how many are using it and how many charges are being estimated.
It just, that was the determination at NC. A refrigerator for the pharmacy. Going back to our, it's really, that might be one to submit, because the true intent of the activity was training or hardware, software, or machines for remote pharmacy services as part of access that appears to be more of although it's not direct patient of a supply for operations. Okay, are there other questions? Just looking to see. Someone asked earlier about the electronic health record. Yes, the EHR cost, you could either look under an ACO activity health information technology, training hardware software, as well as under in the value-based purchasing investment, alternative payment model quality. So EHR software and training that helps up hospital or practice with quality measures within their EHR, clinical practice improvement, meaningful use, that would be allowable. So two different areas for EHR. Okay, and then I will go back to the next slide is the coordinator resources, especially for our new coordinators, or even if you need a refreshing. We have a webinar recording on the website that's linked. And then there is new SHIP coordinator orientation. That's a one-on-one call with the center and your PO. And you can schedule that with Matt or Caroline. And we, encourage, if you want to have someone also from your financial office in terms of if you're doing sub contracts or awards to the hospitals, that's fine too. We've done that with some state coordinators, and their finance person joins as well. There are SHIP coordinator resources on the webpage, and that includes some past webinars of best practice examples. And we are available to review NCC submissions, whether that be your 12-page narrative or your work plan, maybe a budget narrative. We can do those up until January 28th. I did make a note. We'll find or create a budget template narrative. So we can get that added up as well. And then the distribution list. If you have updated contact information for new staff, or things are moving within your state office, someone else is doing SHIP, or 2 people now, because we know there's different components of SHIP, just send SHIP TA the phone number, email, and we'll make sure that person gets added to the listserv. Also, it's good to know if people leave, so we can keep our listserv cleaned up. And so I know before we wrap up, there's some more questions, Matt.
Yeah, and there's a few things I want to do. Number one, Stephanie had mentioned, and I do want to reiterate, I know Janine and Sarah feel the same way about this. Yes, it has gotten intensely more complicated to figure out what is allowable and what is not allowable. Even in just the time that I've been with the center, things have changed pretty rapidly. And I always defer back to, number one, is it going to help directly treat the patient? That's my first qualifier. But even then, it's a little confusing. And we had a question about fridges. Like, fridges aren't allowed if they're going to store medicine or medical supplies that will treat the patient, right? So that's a little interesting concept. We've had a lot of questions about like crash carts, right? Training crash carts. So a lot of you who have worked in hospitals know that there are specially colored training crash carts that have fake supplies for training purposes. Those would be allowable, but a real crash cart that just so happens to also be used for training would not be allowable, because it would be treating the patient directly. So yes, it is complicated, and that's what the search tool's hopefully going to try to clean up some more, and I keep updating it. As you guys know, we try to respond fairly quickly. I know a few of you are waiting on responses from me because I'm having to dig in. We try to get you the right answers, and the last thing any of us want is to give you the wrong answer and say yes to something that's going to get rejected, or no to something that you could have done. Ronnie, to answer your question about iPads, we have come to the conclusion that requires prior PO approval. We would ask more questions about the intended use, but we have in the past given, or I know they have in the past given permission for translation services, because it wasn't direct patient care and the patient wasn't using it, the nurse was using it. But again, any purchase, we're going to have more questions for you, Ronnie. So don't just say yes, get in touch with us. Are HCAPs and vendors still allowed? The HCAPs and core measure vendors still allowed, Sally?
Yes, yep.
Okay.
Yep, because that's ongoing quality reporting, quality improvement directly ties to ACO performance and preparing for value-based purchasing. So, yep.
And clarification on the question, HCAPs, those not participating in HCAPs will be eligible for SHIP in 22-23?
Yes, that is correct.
That is correct, Joyce. Appreciate that question. And then Stephanie again asked, well, not again, but asked, where are we at with getting emergency department caps approved as allowable investment for SHIP? ED caps.
And
that's a Janine question for sure, because that's definitely not my purview.
Yeah, so no, as of now, that is not allowable. Yeah, outpatient, not allowable. I did want to take a minute though to say regarding unallowable that when I reviewed the annual reports for some of my grantees, some I sent your reports back to you with comments. Some I just approved and I said, included a note that said I had some questions or concerns about some activities that I saw, and I asked that you follow up with me. So I would ask that you do that. In reviewing the reports, I, kind of took some notes regarding activities that are not allowable. And so if you follow up with me, I can make that information available to you. So if you have that note on your approved submission for the annual report, please reach out. I will go through my notes and, send you some examples of specific activities that some of your hospitals are engaged in that are not allowable. Now, with the annual report, the thing is, when the report is submitted, the activities have already been completed, right? The money has been spent. So there's nothing that we can do about that. So when I say that the, hospitals spent money on something that was not allowable, I am not saying that they need to return funds or anything like that. But I am saying that going forward, you need to make them aware. And of course, as we've been saying, refer them to the search tool because it's really going to be helpful for them in terms of trying to figure out what they can do and what they can't do. But just that going forward, they cannot spend funds in those areas that we've identified as.
And that would be especially important distinction if they have spent funds on something that will have to have reoccurring spent funds in the next year.
Right.
So if she said, hey, you can't do this moving forward, and it's something that the hospitals are planning on doing moving forward, then they need to make alternative plans to pay for that activity.
Exactly. So, if you have that note to reach out to me, please do so. And I will provide you with some specific examples regarding, unallowable activities that I saw in your report.
Robbie, can you go to the next slide? Thanks. This is going to be Janine too, but I again want to chime in. Misty in Missouri, thank you. That is a great suggestion. I had not thought about that. Maybe I had in the past and had not followed through with it. I think that would be a really great idea. Misty suggested putting the dates on when things were added to the search tool. I do think that's good, and we can even put an asterisk if it's been updated or something like that. So I'll get with the rest of the team about what the best way is. I may reach out to you and see what you think about it before we launch it as well. So I really appreciate you. And yeah, okay. So Janine, you're on this page, which is just a list of names, but go ahead.
Yeah, so this is just contact information and want to just highlight the January 28th deadline. If you would like the SHIP team at the center to review your narrative, your work plan or whatever, you absolutely need to have it in before January 28th. And then we just have some general IT grants resources here, how to manage your grant website, EHB help, and your HRSA POs. Of course, there's myself and Sarah. There's a PO map here. We are in the process of having HRSA update this map, but if you go to this link, you will note that when you select your state, the POs for your state will come up. And so where you see Soleil Berry as the PO, as you all know, Soleil is no longer in FORP. So Sarah Kohler will be your PO. So wherever you see Soleil, Sarah is your PO. And of course, Sarah and I are the only two POs. So if Sarah isn't your PO, then I'm your PO. I know that it's been a bit confusing, I would say, over the last 9 to 12 months. We've been playing a lot of musical chairs in our office in terms of PO assignments for various reasons. We've had people leave. I was out on extended leave twice, and so we had to have, other folks step in. But this map is current, except for where you see Soleil. You would want to reach out to Sarah as your PO. And then with grants, they sort of play musical chairs as well, and we are not always made aware of the changes that they make. So, in terms of trying to confirm who your GMS is, I would say look at your most recent notice of grant award that you received. And at the end of that document, your HRSA PO as well as your grants management specialist would be listed there. Okay, next slide, please.
That's going to be the question slide. Janine,
okay.
do we have an expected amount per hospital for FY22?
So yeah, if you look at the template for the hospital funding spreadsheet, you will see, I think it's $12,836. And basically that is the amount that you all were awarded per hospital last year. So with SHIP, when you give us a budget, it's always an estimate. One, because we don't usually know the total pot of money that we're going to have to spend on SHIP. And two, we don't know the number of hospitals that we're going to have, any given year until you actually submit that information. And so your budget is actually an estimate. And we're asking that estimate for FY22 just be based on the amount that you got last year. Now, in reality, you may end up getting more, you may end up getting a little less. It just all depends on the overall pot of money and the number of hospitals that come in FY22.
Thank you for clarifying that, Janine. Question on the pricing transparency software. If are they allowed to reimburse hospitals that spent their SHIP funds on this software for a second year in a row?
I put that comment in there, which we have in the search tool as well. It's not necessarily the fiscal year, but if they did receive, if that's what they selected to use their funds for during this current SHIP year, FY21, then that software wouldn't be allowed for year 2.
Okay.
All right, thank you, Sally. That question came from me. I'm Dorothy. I'm one of the SHIP coordinators in New York State. So we had a few hospitals that did spend it on price transparency software in 2020. So I just wanted to confirm that that change didn't apply to their spending proposals that they have already been approved.
Yeah, not the ones that you've approved for this year. No, just going forward. And if somebody didn't use it last year to do that, they were, trying to do it on their own perhaps. So they haven't actually used it for that kind of first ramp up and training with software. Then it could be selected, but just kind of watch if it's not going into a second year. That wasn't the, intent of the.
Yeah, the spirit of the rule is tends to be bent as often, or tried to be bent as often as possible. But we know again that it's been a rough 12 to 15 months. I mean, not only are you guys personally dealing with COVID on the ground, your hospitals are dealing with it. You've got CARES Act funding and ARP funding all at one time. And we know that some of you are doing both task and SHIP, and this is cutting into some of your task work and things of that nature. You are greatly appreciated and greatly valued. And I say this often in almost every call that I'm on, is just know that at the end of the day, it may seem like a lot of spreadsheets, tables, charts, graphs, and that's what it is. But the work that you're doing here is helping somebody in a rural community get better healthcare. And I just try to always keep that in my head when I'm trudging through the mundane and the things of that nature. So we absolutely praise you guys a lot. We know what you're going through, and we're thinking about you often. And so please keep your head up, and please keep asking as many questions as you want. You're never a bother to us. Even if you just want to talk about what color ornaments you should put on your Christmas tree, we'll be happy to give you guidance on that as well. So just know that we're thinking about you often, and we really do appreciate you guys. We are definitely open for any questions. I'm going to go ahead and launch the post polling, which is basically the same questions in reverse. If you wouldn't mind answering that, helps us determine how good or bad we are doing or where we can focus on. And I will, of course, ask any questions, come off mute if you have them, but I will also stay on for a couple minutes after to answer any questions that you might have directly. Or if you want further clarification on something. We're also available to schedule one-on-one calls, even if you're an experienced SHIP coordinator, if you need more detail about allowable expenses or help working the search tool, or just need a helping hand, whatever you need, reach out to us. Misty, what's your next question? You sent an email to SHIP TA. Well, I'm sorry if I have not replied to you. That's my bad.
Typing furiously, so I wouldn't.
Yeah, no.
It was, so this is where our idea about the dates come in, because we just recently saw that the PCMH application fees are allowable. And we had a hospital ask about RHC accreditation fees, like through the compliance team. And we had initially told them that was not allowable, but then that kind of made us second guess whether we are correct or not.
The accreditation fee is ongoing, or is it a one-time accreditation fee?
The initial, it'd be like the initial accreditation.
That's a good question. I probably going to say no, but I'm going to let maybe Sally or Janine chime in on that a little more. What do you guys think?
Well, the hospital accreditation is not, you're wondering about the provider-based
RHC, yeah.
RHC for that. So what I will, it's falling in the this same one that the, I guess I think on the patient-centered medical home was that's moving them towards value-based care. And it's just that initial enrollment that would allow them to, because the PCMH is so much training as well.
Mm-hmm.
But what do we, yeah, we can share that with Janine unless you have a status on that, Janine.
Why don't we sort of have a powwow
Yeah.
afterwards and kind of think about this one. I just right off the bat, I would think no, but perhaps there are other things that we need to consider before we definitely speak to this. So if you would give us, you know, what's today, Wednesday, give us until Friday, so that we can, you know, kind of figure this out. We will get back to you on that, get back to the group actually with a response.
Yeah.
That's a great question, Misty. And I'm sorry if I missed that in the TA inbox. That does happen from time to time. Do not feel like you're harassing me if you send another email directly to me, or if you're like, yo, hey, what's going on with this? We do get a lot of them. And also, this is my direct office number as well. So keep that in mind. I did get in a question about some COVID expenses are not allowable under regular SHIP. That is true. I will find the writing and make sure I get it out to everybody. COVID expenses are not allowable under regular SHIP. They need to come under ARP. And you can reach out to Jason Laguerre on that. Unless your hospital has declined ARP money, it should come out of that. And then that's a whole different kind of ballgame for ARP expenses. A little more flexibility on what can be spent so long as it's spent directly on COVID mitigation and testing. But you can't buy vaccines. Just FYI. Yeah, so yes, Teresa, I will reach out to you about that, about setting up a one-on-one with you. additional consideration to allowing fees associated with pursuing trauma center level 4 designation. Yes, when we talk about the PCMH application fees or the RHC fees, we will also make sure we include talking about trauma center designations as well. We'll make sure we include that. Thank you, Lisa, for that question. And thoughts. Okay, so we just need to take a look at accreditation altogether, probably. So thoughts on swing bed accreditation when talking about rural healthcare clinics accreditation as well. So yeah, that's a great topic. We have no problem kind of getting together, huddling together during our next get together about these accreditation questions. We want, and just a reminder that we want you guys to get a yes answer. We do. We try very hard to make sure that we can get your hospitals to use the money. So if we can make it work within the spirit of the guidance, we're going to try our best to do that. So, and as Jennifer mentioned, there's a lot of staff training associated with the trauma designation. We will definitely keep that in mind. I'm going to go ahead and end this poll. Let's see. Download those results real quick. Thank you guys for taking the polls. Those really do help us. We really appreciate it. Let's see here. Any other questions? Any questions that I might have missed along the way? Or any other questions about the new grant guidance documents, anything of that nature that you would like to ask? This is not a speak now forever hold your peace situation. It's just a you're here, and if you have a question, you might as well ask it situation. All right, if that's no further questions, I will stay on for another 5-10 minutes. We'll stop the recording here in just a second. I will stay on for another 5-10 minutes if you want to ask something kind of one-on-one there. Sarah, Janine, if any of y'all want to stay, that's fine too, or go on. We really appreciate you guys. You're not forgotten or being neglected. I promise you, we know it's crazy, and we love you guys, and we appreciate the work you're doing on the ground. And Janine, Sarah, do you have any final words as we head out?
I do not. Just wanted to, again, thank everyone for joining us today. Thank you for your questions. And kudos to the center for putting together a really great kickoff webinar for us. We just so appreciate the privilege of being able to work with you guys and the wonderful work that you're doing for the SHIP grantees, and just many thanks to you.
Thank you, Janine. And it's a pleasure to collaborate on the SHIP program and support all of the states. And as we said, that the TEA is better with all the questions and feedback we get from all of you. It's how we got the search tool started and continually review options and expand it. So thank you.
All right, well, thanks, guys. Everybody have a great kickoff to the year. Let us know what questions you have. Enjoy some time off during this season. If you get it, enjoy time with family. Be safe and warm, and we will see you next time. Thank you.
Bye-bye.